I'm a very active person. I love riding my bike. I love running, scuba diving, paddle boarding, kayaking. We do a lot of home improvements, and I noticed that when we were laying ceramic tile in the bathroom and we had just finished chopping and stacking some wood for campfires up north, that I started to get this gnawing pain down my leg.
Penny came to me and was having a lot of difficulty with back pain, leg pain, and walking, getting around. In Penny's case, she presented with a large disc herniation here. As you scroll, you can see it. So we started out with conservative treatment to see if we could get some control of the pain and then help improve her function. And with conservative treatment, as a physiatrist, what we tend to do is start with medications, some restrictions, and therapy.
I took a trip with a bunch of my girlfriends. We went to the Cayman Islands, and I started out walking into the airport and could not walk the rest of the way to the counter. So they got a wheelchair. They pushed me through the airport. We got to the Caymans. They walked a lot for dinner. I couldn't walk down to the restaurant. I had to stop 3 or 4 times on the way to just rest because I was in so much pain. I couldn't scuba dive because when I got in the water, the pressure from my legs going up and being lifted from the water was just too painful. So I ended up sitting the whole time and missed out on a lot of things. So when I got back from my trip, I went back to the Michigan Head and Spine Institute, and we had a discussion about what we should do from that point. And we decided, Dr. Marshall and myself, that we would try the first epidural shot.
The injection in her case was epidural steroid injection. It's where we place medicine into the epidural space, which is around the spine. When a disc herniates, it's like this red portion here you see, and it tends to extrude in different directions. What's most common is backward into the canal, and that's what Penny's did. When we do an injection, we can approach it by coming straight toward the neuroforaminal level that the disc is herniated, or we can come in a more general manner posteriorly here and put it in the space right back here near that disc.
That took most of the pain away, but there was still a little bit of the gnawing pain. We decided after discussion that we should try one more shot. So we did the second epidural, and I had no pain, and I was back on my feet doing all the things I love to do. It's been 18 months, and I'm still running around doing the things that I love to do: running, riding my bike, paddleboarding, scuba diving. It's great to be back on my feet again, and I cannot recommend it more highly than to go see Dr. Marshall at the Michigan Head and Spine Institute.
At Michigan Head and Spine, we love to see patients like Penny that are suffering from back, leg pain, or other musculoskeletal conditions. If you give our office a call, we would love to see you and hopefully be able to help you with your situation. And with the doctors we have here, we can usually get you into the right pathway to get you on the road to recovery.